Visiting the emergency room can be confusing and exhausting, from the long waits, to the fast pace of the physicians, to the even longer waits for discharge. While you can't avoid these factors, you can always prepare. Here are a few ways you can prepare for your next visit to the ER. Step 1. Figuring out where to go. Do you have a toothache or a chronic pain? Maybe a first-degree burn? Depending on your symptoms, there are other places that might be better to visit than an ER and save you a lot of time and money along the way. For example, you can visit your family doctor. If you feel something is wrong with your body, consult your family doctor first. Since they already know about your medical history and conditions, they can tell you if you should go to the emergency room or if they can treat it themselves. If you don't have a family doctor or are uninsured, you can go ahead to the ER and they can treat your symptoms and recommend a primary care doctor for you. Or you can go to an urgent care clinic. If you have symptoms that are not emergencies, such as a light burn or that ring that is stuck in your finger, you should consider going to an urgent care clinic. They can provide the services you need and they'll be way cheaper than in an emergency room visit. And of course, you can go to the ER. The ER is the best place at providing specialized diagnoses and physicians to suit your needs, as well as multitudes of labs and equipment to do a complete evaluation of your illness. This also means it is going to be the most expensive option out of the others. If you think your illness requires immediate attention, you should definitely visit the ER or call 911, and an ambulance can take you there. Here are a few symptoms you should look out for before going to the ER. Loss of consciousness for more than 2 to 3 minutes, a squeezing pain or pressure around your chest, unexplainable numbness to any part of your body, especially the left side, abrupt shortness of breath, severe pain, suicidal or homicidal feelings, high lasting fevers, and etc. All in all, if you feel something is wrong with your body and requires emergency attention, then head to the ER. Step 2. Preparing to go to the ER. Before going to the ER, make sure you know where your nearest ER is and how to get there. A simple search online can direct you to the right direction. Make sure to have a form of insurance, whether private or Medicare. It's okay to go to the ER without insurance, but it will be more expensive for you. Grab a copy of your Social Security card, any insurance cards, photo IDs for both the patient and the guardian, all the medications the patient is taking, important medical records, and a form of payment, whether you're insured or not, and snacks for the long waits. Consider keeping a consent form for your dependents, such as children or elderly, with the local ER, so if you're not available, they can treat the patient without having to wait for court approval. Okay, that was a lot of information. Hopefully, from what you've learned today, you'll be ready the next time you have to visit the ER.
Created using Powtoon.